Welcome back, everybody, on a Monday morning. We've spread out across our studio. Yes, we are practicing social distancing, and we're also trying to answer your questions about the coronavirus. We've got a collaboration with Facebook, and we've assembled a team of experts and correspondents ready to address your biggest concerns. NBC medical correspondent Dr. John Torres is here, Vicki Nguyen, our investigative and consumer correspondent, and Stephanie Rule, our senior business correspondent for NBC News. Everybody's ready to answer these questions, and we've gotten hundreds of them already on Facebook and Instagram. Dr. John, I'll start with you because health is the most important issue. Our first question comes from Katrina. This came on Facebook. And a lot of people have this question. She wants to know, if you get the coronavirus, can you contract it twice?
It doesn't look like it, because it looks like once you get it, your body develops an immune system to it, or immunity to it, and you get the antibodies, and you can't get it again. We don't know how long that protection lasts, though. We think maybe a year or longer, but we know it's going to last some time.
Okay. Shannon on Facebook asks, if we do contract it, how do we treat it?
So right now, there's no medicine to treat it. There's no cure for it. And it's supportive treatment. So if you get it at home, you do the same thing you would for a cold. Fluids, rest, anything to bring your fever down. Cough medicine if you have that cough. If you get it in the hospital, we're going to do more advanced supportive treatments.
How would you know that you need to go to the hospital?
So the telltale sign for this virus, it's a respiratory illness, is that shortness of breath. So if you start getting shortness of breath, that's definitely a sign to go to the hospital. And that, I mean, you're having a hard time getting a breath in, or if you start getting sustained fevers, especially if it's over 24 hours or above 101, then you probably want to get checked out.
Are there certain medicines you should just have on hand?
Yeah, this simple cough and cold medicine type situations, you want the things that can bring your fever down. We're talking Tylenol, ibuprofen, acetaminophen, those types of things. Any kind of thing you can use to get your cough under control, guaifenesin, dextromethorphan, and those medicines. And then again, lots of fluids.
Okay. Kristen on Facebook asks, can you get the flu and the coronavirus at the same time?
Yeah, you can get them. They're two different viruses. One's influenza, one's coronavirus. It's very rare, but theoretically it can happen. If it is, it's just unfortunately a lot of bad luck at that point.
Absolutely. Okay, Lisa on Facebook is 27 weeks pregnant. Her doctor's office is in a hospital. She's got an appointment this week. She wants to know, should she go to that? Should she physically go to that appointment?
She should call her doctor and ask the question if she should go, because it depends on what the appointment's for. If it's an essential appointment, which most of them are, especially later on in the pregnancy, you want to make sure you keep that appointment to make sure the baby's okay, or if you're high risk for any reason. And talk to the doctor. You know, what are you doing in the office? What are you doing to protect women as they come in? And if you like the answer, go ahead and go.
It raises the question, what do you do if you're a pregnant woman? We've talked about different groups that are vulnerable. And pregnant women, are they or are they not?
So the American College of Obstetrics and Gynecology says that it doesn't appear that women are at any higher risk of developing it or getting complications than anybody else, but they still put them in an at-risk category because their immune system gets suppressed anyway during pregnancy. And the studies, very limited, very small amount of children, it did not get passed on to the fetus from the mothers that did have it. So
okay, that's hopeful, but as you said, it's just a
very limited amount of data.
Well, it's a novel virus. That's why we're still learning. It means we haven't seen it before. Cynthia on Facebook has found, I love this one. She found a bottle of hand sanitizer in her closet, but it was expired in 2006.
We all have this, don't we?
We love you, Cynthia. I'm right there with you. So does it still work?
I wouldn't use it at this point, only because that alcohol could evaporate. In 2006, that's 14 years ago. Yeah. That's a long time for it to evaporate.
But a little bit longer? I mean...
potentially. If it's a year or two, usually we say about a year or so, not bad. In this case, just wash your hands.
Yes. Okay. Well, good point. You can always just wash your hands. And then real quick, Paul on Facebook saw a rumor going around, wants to know, is it true if you have the coronavirus that if you gargle with warm water and salt or vinegar, it will eliminate the virus?
Absolutely not. Once the virus gets in your cells, it gets inside your body, nothing you eat or drink is going to do anything at that point. It's not even going to stop the virus from showing up. So
don't we wish we could gargle it away? Dr. John, good info. Thank you so much. We'll send it over to you, Hoda.
All right, Savannah, thank you. Steph Rule is here to talk all things business, including the impact of the curfews, the reduced traffic, the stores. We got questions for you, Steph. We got Lauren on Facebook. She wants to know, and this is a good one, if our state goes on lockdown, that means, excuse me, we can't work. And what are we supposed to do for income? The most basic of questions.
This is so important because earlier today when we were talking about the rate cut, well, that's important for small or big businesses. They can borrow money. But what if you simply can't go to work, right? A rate cut doesn't put money in your tip jar. If you're a hairdresser, it doesn't bring money in. So here's what we're waiting for. Congress to take action. We talk about this fiscal stimulus plan. Congress decided on a plan on Friday. We're waiting. Now it's going to the Senate. But we're actually hearing more and more people talk about the idea of a national economic holiday. Now, it's not passed yet. Jason Furman, former economic advisor to the White House, said, What about writing a check to every single American right now? Because this is like a natural disaster.
Right.
If we're saying to people, go on lockdown, because that's the right thing to do medically, but you still owe all of your bills economically, well, that doesn't make sense.
Right.
So it's being addressed. There's just not a solution yet.
You almost want just to alleviate people's rent, their mortgage, their electric bills, so at least they don't have that stress on them. Let's move on to April on Instagram. She wants to know if we should be concerned about touching our mail or packages that come into our house.
I get that question a lot. Also, what about touching money?
Yeah.
Now, there's more we're learning about corona every day, but as far as transmitting it on surfaces, not really happening yet. Just a reminder, wash, wash, wash.
Well, you know what's funny? I was trying to update my cable because I don't have some thing, and they said, "Well, bring a guy to your house." And I said, first of all, I said no thanks, but they said no. The guy's got gloves on. He's going to wear a suit. If people are coming in to do business in your home, plumbers or cable people, would you say no?
Just be safe.
Yeah.
Right now, you want to do essential things. I wouldn't necessarily be doing construction at my house,
Right.
That was optional. But if you need a plumber, if you're locked in your house and you need a plumber, you need a plumber.
All right.
Yes.
Lyra on Instagram asks this. Grocery stores are running out of paper products, cleaning supplies, and food. How are we supposed to self-quarantine if we can't get the food that we need? We've got to go out, basically.
We've already heard from the CEO of Walmart, Doug McMillon. They've extended their store hours. Target is saying we are trying to get things on the shelves, and this is an opportunity. When you go to your local grocery store, please say thank you. Give a shout out to those people who are filling the shelves. And we're actually seeing some businesses change what they do. LVMH, the luxury brand that makes Louis Vuitton, Christian Dior, they are stopping making perfume, and they're now going to use their operations to make hand sanitizer and give it out for free.
Wow. And back to what you said about the people who are working at the grocery store, they had fewer lines where I was, and people are complaining, like, why don't you open more lines? I'm like, no. You just wait patiently. These people are here. They're handling your food. Here's another question.
They're putting themselves at risk. Be patient.
Big time. Lisa on Facebook wants to know, and maybe the most important question of all, as a small business owner, how will I survive?
I hear you, girl. It's really hard, and it's easy for us to say, make sure you're keeping your business open and make sure you're paying all your employees. That's easy if you're a massive CEO. We learned this weekend that Nike and Apple are closing their stores. Well, those are often anchor stores at a shopping mall. They can afford to do it. But what about the trickle down? So for small business owners, they're waiting for that fiscal package. We know that the Small Business Association is offering loans. Rates are lower. And on a big level, we've seen some positive things, right? NBA stars have now Steph Curry has done it. Kevin Love has done it. They're sharing some of their salaries with hourly workers. But you got to keep thinking about ancillary businesses, not just those hourly workers. What about the bars and restaurants that are near those stadiums? The government's got to start to figure it out.
Congress has got to get this thing passed and quick. All right, Savannah, over to you.
All right, and joining us now by FaceTime is Vicki Wynn. Actually, Vicki, like Craig and Al, is working from home as a precaution because of our colleague on the 9 o'clock hour. So, Vicki, it's good to see you
It's great to see you.
Internet, and we've got a lot of good questions for you. Let's start with Gail on Facebook. She wants to know, is it necessary to wash your clothes when you come in from doing food shopping or being out and about?
No matter what you're doing when you come in, Gail, it's not necessary to wash your clothes right off the bat. The CDC is saying that this virus can live on hard surfaces for 2 to 3 days. Some studies have shown even longer. What's unclear is how long it can live on clothing or carpet. But some global health doctors that we have spoken to say it's not a bad idea to change into some indoor clothes and indoor slippers when you get home, and keep those shoes and the clothes that you're wearing outside in a separate place, just as an extra precaution. But you don't have to throw them in the washer and dryer right away.
Yeah, I got my kids in home clothes, we're calling them now. We switch out.
Yeah.
Okay, Jackie on Instagram has a concern, and a lot of brides do. She's got a wedding in June. Does she need to consider canceling?
Jackie, first of all, congratulations.
Yeah.
And secondly, the CDC overnight just said it wants to postpone or cancel all events in the United States of 50 people or more. Assuming your wedding is going to be that big, it falls into that category. I know it can be expensive. I know it can be heartbreaking to put this off, but think about it. When we get through this, and we will, how bad it will be depends on us and the actions that we take in these coming days. Yeah. But when we get through this, your wedding will be such a better celebration when everyone can be there happy and not worried about getting sick or getting someone else sick.
Yeah, if the wedding's in 8 weeks, the CDC, it's clear that it can't happen. If it's in June, I think it's a tougher question, but perhaps in an abundance of caution. Social distancing, our viewers have a lot of questions about the specifics. Can you go to the gym or attend group exercise or personal training?
Okay, so social distancing, the definition has evolved so much. Initially, it was, hey, put 3 to 6 feet between you and someone else. This world is changing. We are in unprecedented times. And really right now, what public health officials are saying, social distancing really means isolating yourself and only going out for things that are vital. These are the questions you need to ask yourself. Is this vital? Is it essential? Does it have to be done right now or can it wait? And if the answer is yes, how can you do it in such a way that you limit contact with other people? Can you go early in the morning? Can you go late at night? Can you avoid people? Can you do it in an open air space? This is a good time to be checking YouTube and apps where you can do a workout inside that may not require a physical gym. In fact, this morning, I believe Miguel said that the city of Los Angeles has said to its gyms to close. That may be spreading across the country. The idea right now is that we need to limit contact so that we can flatten the curve, reduce the rate at which this infection spreads. And the choices that we make right now are going to determine what this infection looks like and whether or not we overwhelm our healthcare system. If we can keep the rate of infection low, that's going to be good. If we see a spike because people are doing non-essential things, that's going to be bad. Okay, and to that, I only have a few seconds left, but a lot of people are wondering, okay, if I have a teenager, can the teen have a friend over? If you got little toddlers, could I have a toddler over? The kids are going stir crazy. What about that kind of one-on-one visit? I've read so much about this, and I feel like the shift from pediatricians and doctors went from maybe have a buddy family, one family that you trust, and you can get your kids together and play outside, kick around a soccer ball. Now what I'm reading is absolutely not. This is not the time for play dates. As frustrating and difficult as it is, we have to accept that there are going to be major social disruptions to our lives, but these are small-term inconveniences. This is short-term pain for long-term gain. Yeah, and we're all in it together. Vicki, thank you very much. Thanks to Dr. John and Stephanie Rule as well. We will be answering your questions all